Good day, I'm Stephen McHugh, and this is your JIS News for Wednesday, September 22. Government is in support of the recent findings of the Auditor General's report on Nutrition Products Limited, NPL, which found several breaches. In the Auditor General's performance report, which covers the period 2015 to 2021, it was revealed that NPL's recruitment and selection process was not always in line with its employment and recruitment policy and circulars issued by the Ministry of Finance and the Public Service. Among them, the hiring of a human resources manager who had only 6 GCE subjects when the post required a Bachelor of Science degree in social sciences with at least 6 years of work-related experience. At this morning's post-cabinet press briefing, Minister of Education, Youth and Information, Favour Williams, whose ministry has responsibility for NPL, pledged the ministry's full support of any further investigation into the matter should it become necessary.
Let me say, without a shadow of a doubt, that the findings demonstrate serious breaches of the government's Public Bodies Management and Accountability Act, and that, on reading the report, it may require further investigations by other constituted authorities empowered to take legal actions based on their findings.
Minister Williams, meanwhile, says government has already started the NPL reform process, including the installation of a new board and the granting of the approval for the privatization of the entity. The House of Representatives has begun the debate on the updated National Identification and Registration Act, NIRA. Justice Minister Delroy Chuck, who opened the debate, says the new bill will strengthen the National Identification and Registration System, NIDS, and increase the protection of the right to privacy of enrolled individuals. It's also expected to improve the oversight authority of the Registrar General's Department, which will be named Office of the Registrar General.
This bill is a living representation of the views of the Jamaican people. It embodies the recommendations of a joint select committee on the previous iteration of this legislation. These recommendations were made as a result of an intensive round of contributions from concerned citizens of Jamaica, members of the diaspora, and various stakeholder interest groups. Madam Speaker, this bill is one of the most responsive pieces of legislation ever put to this Honourable House.
The Justice Minister also says the updated NIDS bill is the first legislation that will require the encryption of personal information in compliance with the best international practices for information security. The National Identification and Registration Act was tabled on July 21 and will seek to establish the National Identification System, NIDS, where Jamaicans can choose to have a secure national identification card. Jamaica has called for the global acceptance of COVID-19 vaccines being administered in developing countries. The call comes amidst reports that certain countries do not recognize the fully vaccinated status of persons from developing countries like Jamaica. Currently, the island's most widely administered COVID-19 vaccine is the Oxford AstraZeneca, which has been secured through the COVAX facility and by donations from countries such as the United Kingdom.
Jamaica would ask that the WHO and PAHO intervene to ensure that essential medicines and health technologies that have gone through the rigors of approval are recognized and accepted globally. This we ask as vaccines approved by the WHO, taken by our citizens, are not being accepted in some countries.
Chief Medical Officer Dr. Jacqueline Besesa McKenzie made the appeal Tuesday during Day 2 of the 59th Pan American Health Organization's Directing Council meeting in the United States capital of Washington, D.C. The Directing Council brings together health authorities to determine priorities, set policies, and coordinate technical cooperation among countries pertaining to health in the Americas. Meanwhile, Minister of Health and Wellness Dr. Christopher Tufton is urging the international community to address the inequities which exist in accessing tools to tackle the COVID-19 pandemic. Dr. Tufton says there is a wide disparity as it relates to the access developing countries have to COVID-19 vaccines, as well as other health technologies such as medical-grade oxygen. The health minister made the call as he chaired the opening session of the 59th PAHO Directing Council meeting Monday.
Vaccines have become a critical tool for recovery. Yet, a disproportionate amount of the over 5 billion doses administered globally has gone to high-income countries, while some countries in our region have vaccinated over 50% of their population. Others remain below 3%. More than a third of countries in Latin America and the Caribbean are yet to vaccinate 20% of their populations.
The World Health Organization's data up to September 17 showed there were more than 226 million confirmed cases of COVID-19 and over 4.5 million deaths globally. The region of the Americas had the highest numbers, with over 87 million reported cases of COVID-19 and more than 2 million deaths.
Although inequality has always been a defining feature of the global economic order, COVID-19 has sharpened inequalities, raising critical questions as we move towards COVID-19 recovery. Questions about the role of multilateralism in addressing shared public health challenges.
Minister Tufton encouraged countries to commit to building a more robust healthcare system with greater emphasis on primary health care, health financing, and increasing capacity for emergency response to disasters. In other news, the Ministry of National Security says it is treating the engagement of youth in crime and violence as a matter of national urgency. Portfolio Minister Dr. Horace Chang was emphasizing the stance of the government while speaking at the United Nations Development Programme's UNDP Youth Summit on Crime and Violence yesterday. The summit was staged in observation of World Peace Day.
All of government priority are taking necessary steps to ensure the social development initiatives are relevant to the targeted population, impactful on crime.
According to Dr. Chang, on average, 40% of all known murder offenders in Jamaica are young men aged 15 to 24 years. Over the past decade, victims and perpetrators of Category 1 crimes also fall within this age group. Meanwhile, in 2020, 16% of murder victims were between the ages of 15 and 24. The National Security Minister disclosed that young people in this age range are taking up leadership roles within violent gangs and are being groomed by dons and other violence producers to commit gun and other violent crimes.
Governments must ensure that the public services to the areas which are dominated by criminal activity are improved and can provide the opportunity and the environment in which young people, young adults, male and female, in particular, the number of young men are growing up in a better environment and can achieve their ambitions and dreams.
And finally, the National Health Fund, NHF, has launched an online application system which allows doctors to register their patients for NHF cards. The move is in a bid to increase accessibility and convenience to NHF beneficiaries. To apply, doctors may go on the NHF online application portal, select and certify the conditions for their patients, add the patient's Tax Administration Registration Number, TRN, and submit the information to NHF. Once received, patients are contacted for any additional details, the applications are processed, and they are advised to come in to collect their NHF cards. For more information on the applications process for their patients, doctors can email the NHF at customercare@nhf.org.jm or call 876-906-1106. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.